Suicide impacts not only individuals, obviously, but families and communities in the form of sort of a ripple effect of shock, guilt, shame, embarrassment. Not only that, but also we know from statistics that people who have attempted suicide but did not die are at an increased risk of attempting again up to 3 months after that attempt. We also know that people who have died by suicide, their family members and loved ones are also at increased risk for up to 3 months as well. Parents that lose a child to suicide are at high risk of suicide themselves for up to a year. So I think it's important to understand sort of the downstream effects of not addressing the problem and the issues that come from hiding things because we're too embarrassed to tell others about how we're feeling. So community and culture play a huge role in not only suicide prevention, but also suicide awareness, which they kind of go hand in hand. But the culture is a big deal, and I think what we're trying to do as a community mental health agency is kind of change the culture in our area to saying, hey, it's okay to not be okay, and that if you feel this way or have these thoughts, that you should tell someone. Because if we have a culture or a society or community that stigmatizes thoughts of suicide, then the people that feel that way are going to be too ashamed or embarrassed to speak out, and there's nothing that can be done if we don't tell other people, and then all of a sudden it's too late and everyone's thinking about what they could have done differently. Well, I say what we can start doing differently is change the culture on how we treat suicide and how we think about suicide as a community. So we want to encourage people to tell someone if they're feeling that way. Some key warning signs that are common for people that are thinking about suicide or even planning or having intent for suicide are social withdrawal, giving away things, mood swings, and exhibiting risky behaviors. It's important to recognize these signs because when we recognize them, we can know to ask them if they're feeling this way. So if you believe that someone you know is at risk of suicide, it is important to stay calm and offer a listening ear, and also just ask them directly, are you thinking about suicide? Have you had any suicidal thoughts? Do you have a plan? Have you thought about it? It is a myth that asking these questions gives someone the idea to die by suicide. When you ask them directly, it kind of eliminates the issue of there being any ambiguity or vagueness or kind of beating around the bush, if you will. So it's important to ask directly, and I think knowing that asking directly doesn't encourage someone to do it. If they were already going to do it, it doesn't matter. So, ask directly. The 988 crisis line has been very instrumental in helping reduce the suicide epidemic, if you will, by having a national number and having something that's easy to remember and something that's 24/7. And that really plays a huge role in reducing risk and getting people connected with help. At Newhaven, collaboration can be achieved by forming partnerships between local organizations, healthcare providers, and community groups. So people can get involved by participating in local support groups, volunteering with suicide prevention organizations, and attending community events. At Newhaven, individuals can join initiatives, advocate for mental health resources, and support local campaigns to keep the conversation going year-round. The message of hope that I have for those that are struggling with suicidal thoughts is that you're not alone, and you're not the first person to have these thoughts, and frankly, you're not going to be the last. And the core message I would want you to take away from this is that there have been people that have been in that place and that have made it to the other side and are glad that they chose life. And another thing I would want to add is that, a lot of people think that the goal of someone who is suicidal is to die, and that's not really the case. Their goal is to end the suffering, end the pain, and they think that taking their life is the best way to do that. And our job as mental health professionals is to get them to come up with other options, other resources to help them alleviate their suffering that is not taking their life. It's essential to remember that prevention is not just about identifying risk, but also about building a supportive community and fostering resilience. Small acts of kindness, open conversations about mental health, and ongoing education can make a significant difference in preventing suicide and supporting those in need. It provides a lot of meaning and purpose for my life and what I believe I'm here to do, but it also, at the same time, places a huge responsibility that sometimes makes me a little nervous, but I honestly wouldn't rather be anywhere else.